Okay, Assalamu alaikum, sisters. So today we are going to talk about again. Today is November the 1st, and let's see what we have today. So I would talk about the aphorism. At least I like to mention aphorisms because that was the laid down foundation from the great master Dr. Hahnemann. So, you know what is the meaning of aphorism? Aphorism means to define. It's mostly it's used, it's a Greek word to mean define. Last time we said what is the first aphorism? First aphorism was that the
Arnica withdrawal.
yeah, the
Nexonica.
physician's highest and only mission is to restore the sick to the health or to cure. Okay. So
Mm.
let's look what is the second. Second is the ideal. What is the ideal cure? The ideal cure is based on the law of simila, and it is the ideal is to cure rapidly, gently, and restore the health permanently in its whole extent. Okay, on and then these are the principles of homeopathy. So, ideal, rapid, and gentle cure to the core is the second aphorism. Then, then we talked about the levels of health according to the classical homeopathy and by the Professor Vitokas. Remember, we said there are 12 levels grouped in four. So each group has three levels, right? So the highest group or the group A, yeah, you can take it. It's not there. So the group A is the level 1 through 3, and the thing is that for level 1 through 3, the patients are mostly in a good level of health, and the potency, that's why you can give a higher potency up to 50 m. And what does m stand for? What does m stand for in homeopathy?
Mother? Mother tincture?
It is not mother tincture. What is c? What is c? C is centesimal or 100. M is 1000. Mother tincture is Q, is mentioned by this letter Q.
Phi or phi.
So 50,000. So the first level of health, the person are in good state of health, and you can give higher. So the group B is second. The levels are 4 to 6. Group C and then group D, and we'll go over that. I don't want to bore you with all this, but these are the levels of health grouped in four groups. Okay, uh, we can go over these. The first group or group A, where the levels are 1 through 3, these people are in very good state of health, and these people rarely get sick, and they have mainly functional, not psychological, emotional, but functional problems. They do not need a lot of homeopathic repetitions. I will not go over all these groups because that's too much to handle. But all remember the first group. Why I am mentioning the first group only at this point? Because we are also looking at the levels of health and the response of these people or to the remedies. So we said that whenever you give a remedy to the person, then there is a response on emotional, mental emotional level, physical level, energy level, and concomitant complaints. Okay, so these levels, they will show the response. In energy, the exaggeration can be that the person would feel very, very, very tired. They want to sleep. The body wants to rest. The person can have some kind of mental irritation, mood irritation, or they can be aggravation of the concomitant complaints that if they're coughing, they'll cough a little bit more. This will not last for long, and then it would be followed by a recovery. This is the first reaction. Okay, Dr. Professor Bitokas had 24 reactions. This is the first reaction. So you'll see there are three lines over here, and there is an initial aggravation followed by a recovery, decrease in all those three. And this is a time period of 1 month. This is mostly seen in group A and group upper level of group B people. We discussed that last time. Today we'll say in the second picture of after giving the remedy can be that there is little or no aggravation. Okay, see, it all came down. And if it is group A, it's good, it's the correct remedy. So there can be aggravation, everything went up and then came down. In group A, very good. Or in group A, nothing went up, all came down. Came down means he got better mentally, emotionally, physically, energy got better, everything. This is all good for group A also. These are the different pictures that we are talking about that we can see in our people when they start taking the homeopathic remedy. Any questions so far? So, this is what I have about the aphorism, about the levels of health, and the response of the person after they take the remedy. This is what I have. Now I'll go to the second part, and that is discussing acutes, how to open the door or the Pandora box when you come, when a patient comes to see you. Any questions so far? Then I'll go to the second step. Okay, if you don't have any, let me go over. I sent you, okay, last time a sister, she asked me that she wants to go over the two remedies, sepia and phosphorus. Okay, so sepia and phosphorus are two very useful remedies. Sister, I have used them a lot. I've used them in quite a few patients of mine, and at currently I'm giving them to one of them. This lady, she is on a family way, and she was complaining of pain in the female organs, her body. And she I have been treating her for different ailments for some time. So what she was telling me was that I repertized her also, and I keep my repertization chart somewhere. She was complaining of the pain. I'm not sure if I took a screenshot. It's okay. So let me talk about, is Sister Umama here? No. I want to talk about phosphorus and sepia. They are really very, very useful remedies. And phosphorus, but
Yeah, I think her mom was here, Sister Nishaba.
oh, okay, okay. Thank you for coming. Umama, I want to talk about phosphorus because you want me to. It is useful remedy. I have given. Okay, sisters. The important thing is that when phos PHOS why are you not going there? This is for. I always do control find.
It's 10:30.
And oh, okay. Now it's working. Now it's working. Okay, this is phosphorus, and then we'll go to sepia. This phosphorus remedy, the person of, okay, remember there are two things that you give the remedy for. One is the acute symptoms, and second is the constitutional remedy. So whenever you see a patient, and you will see mostly in acute phase of patients, or the patients would come and they are taking medicines because they have chronic conditions, chronic allergies, maybe some joint issues, or maybe some people are going through some other diabetes or hypertension or any other chronic ailments. Uh, not I'm in a class. Thank you. So, so people are on medication. That is why their condition or their symptomatology is not very, very clear. Okay. But when they come and they appear, they come, we'll have to look for the constitutional. What is the constitution of that person? So we give them the constitutional remedy, but these people or we all go and have some acute symptoms above the constitution. Mostly, I have prescribed phosphorus as a constitutional remedy, but every remedy can be given for acute symptomatology and can be given as constitutional remedy. This remedy, phosphorus, I have used mostly as constitutional remedy, but it can be used for both the conditions. You guys understood what I mean? Constitution is something which is the overall picture of the person, including mental, emotional, and physical characteristics. Acute symptomatology is that a person with a certain constitution started vomiting, had food poisoning. So you will give them at that point, based on their condition, as a remedy which is not constitutional but acute for their current symptoms. But when the person gets better, you go back to the constitutional remedy if needed. Okay, so reevaluate the case and if needed. So what I'm trying to say is I have used phosphorus mostly for the constitutional remedy. What is the constitution of the phosphorus? Phosphorus people are very lively people, mostly. They love to be the center of the attention, and they love to talk, and they are really, they're very enthusiastic and creative. Okay, they love to talk. They are not the people that mostly they will not be the people that you will find them sitting somewhere quietly. No, they love company, and they love to communicate, and they love to learn. They'll be the joy of the party. Okay. uh, and also these people, they, but again, when they are said something, I mean somebody is giving them some critical remarks, they feel very bad. Anything negative, it hurts them badly. Any bad remarks, any bad report, it will hurt them badly. Therefore, so they're people pleasers. Can you see that? They're people pleasers. They want to be center of attention. So they are anxious people. They get anxieties. They want, and they also want to help. They're sympathetic. They can feel the fear of others. They can feel the pain of others. Uh, and they're very intuitive. They're intuitive or clairvoyant. We all know about clairvoyance, right? They think that they can guess what other people's feeling are, because they're people's persons, so they understand people, they connect with them, they feel their pain, they get anxieties, and they're also very afraid of thunderstorms. This is very important. Thunderstorms and any of hurricanes and strong wind, it makes them fearful. One, okay. The best thing which helps phosphorus is sleep. When they go to sleep and get up, they feel good. Sleep is like their medicine. You'll see some people, they don't feel good after they sleep, but these people, they feel good after the sleep. They feel very good. This remedy in acute cases is given when somebody is bleeding a lot. There is very profuse hemorrhage, okay, and blood is very red and liquidy. It's not in clots. Now, pay attention to what I'm saying. Blood is liquid, red, because if it is of different color and in clots, you have different remedy. So, in acute cases, when somebody is bleeding profusely in red blood and it's not clotting, phosphorus would help. Again, then, important thing, they love to drink water cold, ice cold. When somebody says, oh, they love ice cold water, always think about phosphorus. Okay? But again, the second thing is when they drink cold water and drink and the water goes in the stomach and becomes warm, there is aggravation and they don't feel good, or sometimes they vomit the water out also. Then the cough. What is the cough? The cough is whenever they talk or they laugh. I mean, do you know these people are talking? They talk too much. They're people pleasers and anything. So now this cough is the one which is going to stop them from talking, right? They cough when they start talking. They will start coughing. And since they have been sympathetic, taking care of people and everything, they get burned out. They become apathetic and like you see, I think this entertainer, I mean this is like he's trying to please everyone and happy and he's burnt out and he just becomes indifferent and apathetic. So this is about phosphorus. These are the phosphorus people. When you see, if you see somebody sitting in the corner, quiet, don't want to go out, don't want to feel and talk to people, you have to ask, was he like that, he or she like that from all the time or from the very beginning? And people say, no, no. He used to laugh and everything, and now I don't know what has happened. Maybe he is or she is in this state. But generally, they are these kind of people. This person, like in you see, they are putting you over here. These from the everybody is looking at this person who is just talking and making people laugh and sympathizing. Some people they also say homeopaths also say that phosphor is a hypocrite. He shows that he's sympathetic, but he is not as sympathetic as he shows. But there are people and he'll be very friendly, he'll talk to the people and he'll be very joyful and want to learn, but they get hurt very easily. So any questions so far? And they're very very afraid of thunderstorms. They are sympathetic and they're clairvoyant and the sleep is their medicine. Sleep, when they go to sleep, they feel so good. Very important thing. And in acute cases, when they bleed, the blood is red and does not coagulate. They love ice cold water. Ice cold. They love to drink water which is really very, very cold. Okay. So this is for phosphorus. If you have any questions, I have given this to my quite a few of my patients as a constitutional remedy. So let me start sepia. I sent you this one book which is about mamas. Sepia is, it can be used for anyone, but mostly it is used for women. Okay, it is mostly used for women, and I'll show you the pictures. We don't have any questions, right? Okay, sepia. Okay, sepia. Sepia is a cuttlefish. If you see sepia, how many tentacles? Has many, many tentacles. This is like a woman who works so much. She does anything and everything for the family. Okay? She does anything and but how is she treated? This woman is very dignified and proud woman. But it's she is not she does not know how to let people treat her. So she is not treated with honor. Okay, this person does not want to have no relationship with the husband or any sexual relationship. Aversion, complete aversion. They cry a lot. These pictures they don't show. I like one picture which, and they work so much for the family, and they work too hard for the family, but then they give up, they get burnt out, and they just want to leave. They pack up their bags and they leave, and the family is just surprised why she left, because she got tired. I'll show you a picture which the men, sepia men, they are very soft and they have very little self confidence. Okay, these women, they mostly have a very bad bearing down sensation in the uterus. And I gave this remedy to this one lady this last week because of this sensation, especially she was pregnant, and she was having this sensation. And I took a couple of other symptoms and repetized, and sepia came up, and she got better with sepia, and she's now fine. They sit with the legs crossed because they feel like the uterus is going to fall off or their organs will. The gynecological ailments would be they during pregnancy they have headaches, they're very very tired, and these women they mostly have physical problems before, during, and after menses. So remember, this is mostly a lady's remedy, a woman's remedy. The good thing about the important point about these people are that when they exercise, they will tell, when I work in the house, I feel better. When I do some physical work, I feel good. This is a very important point to pick up in these women who with any problems. When they say they work in the house, they feel better. This is a very, and this lady to whom I'm telling you that I gave this remedy, she gave me this point also, that whenever she is doing the work in the house, she feels better. And so I gave her based on that, and she was okay. I wanted to show you another one, and I think I'll have to send you guys. I don't see that book in front of me, and it's very very useful book. Uh, and it's called Picture Homeopathy. I think yeah, it's too big. I have this script, and I have subscribed and I have paid for it, but it's not a lot. And it's a good site that I can get all the books from here. And I want to show you that Picture Homeopathy. That's a very useful book. I think I gave some. Okay. Any questions so far? Everybody's so quiet. Okay, maybe I'm not able to find it now. I have to send it to you guys later. Okay. So, anyone has any questions so far? No?
Mm.
Yes. Have any question?
No.
No, no.
But did you understand? So, when would you give sepia to a woman? When would you give a sepia to a woman?
He works too hard.
How would she present?
With dignity.
How? What would she say?
She feels better after exercise.
One thing is she feels better after exercise, but what else?
Um,
She is
These
very
always,
dedicated.
huh?
She is very dedicated.
Oh, there you go. This is the guy. This is the book I was talking about. Picture it, homeopathy. See, I can download it, and I can download many books. Yeah, I have this book, but this is, see, this is 5 megabytes. I will send you guys this book. This is very useful book. Okay. So let me show you. Sisters, these women, they work too much, they work too hard, they have a big family, and then they are tired. They are tired and they will yell and scream at their children and people also. It's not that they are so quiet. No, no, they're done. Okay, they are done. They are done. They're so tired, irritable, and detached. These women in postpartum depression, some many women they will get postpartum depression. Depression. They will have their child laying down screaming. They won't care. Dignity is dignity is wounded, so they don't care. They're sitting. They will not. Okay. Now, over here, you see indifferent. They're indifferent. Somebody's crying, children are, they say, no, I don't want nothing. And they'll be very sarcastic. And then they are tired, they will cry. And at one point, they were very helpful and they were happy and they were taking care of everything. But they suddenly, they say, I don't know what has happened. Everything has changed. And they just don't want to be around no one. So they were happy, affectionate, and mostly they are women, and now they're quiet, indifferent. They don't want to do anything with anyone. They are sarcastic. They feel better after exercise. These are the women which would be helped with sepia, postpartum depression, sepia, because remember, we know that delivery is a big issue. When all the housework, when all the work outside, it just gets the best out of them. They get they can go into the sepia mode. There is another picture I will send you, that sepia picture. I like that picture a lot. And then I don't know if I have phosphorus. We'll talk about is this no phosphorus? There, phosphorus. If you look at the phosphorus, phosphorus be uh, phosphorus are people who just, they're clairvoyant, they are attention seeking, and they're very sympathetic to others, but they are like, they look like, oh, you need help, how are you, but they don't mean to go deeper. Okay. And they, I have, remember I showed you, they have lots and lots of fears. They're afraid of dark, they're afraid of deep water, they're afraid of death, they're afraid of thunderstorm. They, as kids, they're open, they want to befriend with people. They're not like quiet kids. No, no, they're not. And when they bleed, they get nosebleeds. The nosebleeds are bright red in color. They love chocolate and ice cream. They love chocolate and ice cream. They have thirst for cold water, and they also love stimulants. So, anyone has, I'm going to send you both of these snapshots, and I'll see if I can send you this book. Uh, Picture It Homeopathy, very useful book. I'll see, but I'll send you the pictures of these. So anyone has any question? So what I'm talking about is the constitution of a person. So when I talk about, oh, do you love ice cream? Do you love chocolate? Or do you like cold water, warm water? How is the sleep with you? What time you sleep? What side? This is what I'm trying to get. I'm getting into the constitution of the person. So if we don't have any question, let me see. I want to discuss about um
Why there is a lady for sepia and a man for phosphorus?
because no, I have given them for both. For sepia, I have given it to females. I don't have
Mhm.
that bigger circle of patients, but
Mhm.
men are mostly vibrant. You know, when you go
Mhm.
in, I mean, in our society, there are different societies. If you go out and this see in a party or in a wedding or somewhere, and there are men and women together, who will be talking loud? Rarely women. But it's both in men and women. But that's what the person who presented showed it that way. Men are more loud than women, aren't they? But it's for both. I've
It's
given it to
changing a
men and
little.
women both.
Okay.
Phosphorus. It's how they presented it. If I'll make a picture or picture of this remedy, I'll use both. It's that personal preference. And also, it's more prevalent, but I'll use both. So I sent you this cell salts picture. I sent you by Karen Bartlett. I also ordered this another. Okay, this lady, uh, Lisa Starbuck. I listened to her interviews. She has a lot of knowledge, and she's very doing. She has a lot of knowledge about homeopathy, and she's doing a lot of good work. I think on in Europe. And this book is out there. I bought two of her books also. These pictures for the different remedies is, and especially for the pregnant women, they're very very useful. The way she has explained, very, I liked her style. I mean, many people do, and I'm one of them. If you look at this is a fish. This is the expression of this is a sepia, and that's how she has explained sepia. Mostly it's used now. She's talking mostly in pregnancy. This has most of the women have hormonal issues, right? Men do not have hormonal issues as compared to women, because we go through a hormonal cycle. First of all, every month, the people who are the women who are in their menstrual cycle, and then it starts at a certain age when the girls go from childhood to puberty, then when it stops, or then during pregnancy, hormones up and down, after pregnancy, during lactation, and then at a certain age in 40s 50s, women, they start having again hormonal uphills and downhills, and they go through a menopausal state. So mostly this is the remedy which is for uh, hormonal issues. They and sisters, this is very useful remedy for postpartum PPD, postpartum depression. Very useful remedy. There are other remedies also, but these women, they will, and people will say, oh, look at this woman. She doesn't even care about, because she's not well. Okay, because she is not well, baby would be crying and screaming, and this woman, she's not going to go pick her up. They say, what kind of mother she is? She is not a well mother. That's it. Okay, so postpartum depression and CPR go hand in hand. It can save families' lives. Okay, mentally and physically, they are worn out. They'll cry. They'll start crying involuntarily. They're indifferent to family and they're angry and irritable because not they're bad women, they're all hormones are all imbalanced, chemically imbalanced. And they get very, very afraid of thunderstorms and they are not able to do the housework. And thought and smell of food really makes them feel sick. They are better with exercise and worse before thunderstorms. Dancing, vigorous exercise, they feel better. Okay, so these are good pictures for sepia. And if you see, the phosphorus is not here because phosphorus is mostly for a different reason. But this is a very, I think I sent you this book, right? To some of you because it's a very heavy, it's like 26 megabytes. So it was a heavy book. I couldn't send to everyone, but I sent to, this is a very useful book and I really liked. And then the tissue salts, I gave you I sent you the picture of these tissue salts. These tissue salts are 12 and they are also called Sushler's salts. They are given in the form of tablets sometime, and but I also have them in liquid or liquid forms. They and there are 12 in them. Let's see, look at the first one, the calcium fluoride or Calcarea fluor. So where is it found? It's found in bones, of course, calcium, right? Bones and teeth, but it's also seen in connective tissue. I mean, is there? This is predominantly with elastic tissues, veins, and glands, and skin. The people who have problem with the veins, varicose veins, because you know elasticity of the veins is lost. Varicose veins are helped by Calcarea fluor. Varicose veins a lot. The ligaments, sometimes the people with ligamentous injuries, they get ligament torn, and even when it gets repaired, the repaired ligament is not as elastic as it was before the injury. Calcarea fluor is the answer. Weak bones, growing children, or after trauma to the bones, Calcarea fluor. Weak circulation. Why? Because of the elasticity of the veins or the arteries is affected. Calcarea fluor. So Calcarea fluor is very useful for young and also for old, for pregnant women also, and the people who have problems with their teeth. Okay, so loose teeth. There is a tooth over here. Weak bones, circulation, varicose veins, very important thing, very, very important, varicose veins. Okay, these are very, very useful tissue salts, and always buy them in 6x or 3x, and you'll have to take them for a couple of months to see the effect. Okay, and they are safe for all ages and even for your pets. Any question? Let's go over Kariza, and if you guys are tired, we can stop here. But I just want to go over this acutes. And I said we need to go over the acutes. ABC of acutes. What is ABC of acutes? A is for aconite.
Arnica,
I'm sorry.
aconite,
Aconite or arnica. Yes. B is for
belladonna,
belladonna and brynia. Belladonna mainly. And C is for
okay,
chamomilla or carbobelt.
chamomile. Okay,
Chamomilla. So
okay,
ABC of homeopathy. These are extremely useful remedies. And if you have heard about this organization which is called Homeopaths Beyond Borders, have you heard about it?
yeah, through you.
Yes, these are Homeopaths Beyond Borders, and I was going over that. They went to Haiti also in 2010 and they helped people. This is the website for the homeopath without borders homeopath. And then I also went on Wikipedia, and this was an organization, non-profit, which originated in 96, and they were modeled off after Doctors Without Borders. And if you read in homeopathy today, how they have helped in different places, okay, after earthquakes or after disasters. But in the criticism, it says that they were given the award of Golden Blockhead. And this is a derogatory award, means these people have their heads blocked, and that's the Golden Award for them, given by this scientific investigation of parasciences. But that's how it goes. This is information, you like it or not, is another story. So, homeopaths without borders have done some good, and it is documented in different magazines. And I agree with the goodness that they have come up with. So, let's do a little bit about, okay, so aconite or arnica. Arnica or aconite, these are the two remedies, sisters, you cannot live without. You have, okay, so what did the homeopaths without borders used to do? They did not carry a big bag. No, they would have 5 or 10 remedies, and they would go and they would give those remedies accordingly to people who do not have any access to any of the medical facilities. And uh, it helped. So that's what I'm trying to say when I say about ABC of homeopathy. You have to have a kit, a small, it's in my bag. I have this small kit that I keep with me and in my bag all the time with certain number of remedies, which you need to carry with you for yourself, for others, whoever. So let's see. Aconite and arnica are the two remedies that we need to know through and through, and we need to repeat that what are these remedies going to, how are these remedies going to help us. So A for aconite. Aconite is a plant remedy. Aconite is extremely useful remedy for it is similar to belladonna, but in this case, the pupils of these patients of belladonna are dilated, and the aconites are constricted. And these people are very, very thirsty. So, important thing about this is that these when a person is very afraid of death, you will hear that people say, "Oh, death is coming." Death is coming. Acute restlessness. Acute. They'll get up, they'll start moving around. Somebody, a friend of mine, she called me from overseas, and she said that her mom is old, very old, in late 80s, and she said she is very restless. It's middle of the night, and her blood pressure, her sister checked, is okay. What should I do? I said, take her to the emergency. She said she's not willing to go out. I said, okay, give her Aconite 200. She gave her Aconite 200, and the mom was stabilized and went to sleep. And she is still okay. And this happened 6 months ago. So, for acute states, when the person is very restless, you don't know exactly what's going on, it's like opening the door. You know what I'm saying? You don't know why the person is restless. And I'm not saying, okay, give aconite and just if the person still does not feel better, please take medical care. Go and look for the proper medical care. I'm not trying to make doctors or homeopaths with this class. So this is the disclaimer. Please, this is for the educational purposes only. So if the person is very severely very severely restless, and says the death is coming, this is a very important sign. One side is red and the other side of the face is pale. This is a keynote, a very typical, important symptom for which you can give aconite. Or the person when gets up, the whole face, I have seen this, turns pale, and they're very, 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 very fearful. Okay, especially they get fever when they get cold. Like you go out and it's very, very cold, the person comes back and has high grade fever, aconite, feeling of imminent death. They will tell you death is coming, I am dying. They love cold drinks. Who else liked cold drinks? Cold, ice cold drinks, we just talked about that. Phosphorus.
Phosphorus.
Yes, phosphorus. But phosphorus will not be this acute. We're talking about this face is red. The pupils are contracted. How is it different from belladonna? Pupils would be, belladonna is
Dilated.
dilated because belladonna is atropa belladonna. Atropa. Atropine. They are very fearful. Extremely fearful. Somebody has robbed
You said
them.
belladonna is atropine?
Yeah,
Oh, okay.
atropine. The ailments from acute cold. Okay, they wake up when they go to sleep. In 2 hours, they wake up due to extreme fright, and they're so afraid of death. They will tell, "Make my documents because I'm dying." And they are afraid to go in crowds. They do not remember phosphorus is sitting and talking and very, very lively. These people, they are love cold, ice cold water, but they are not people person. They're afraid. Phosphorus also get dark, afraid of dark, but these people are really very fearful. I have seen, remember I told you this one person, he could not fly. He cannot fly. He is 30 something. And when he flies, he holds the hand of his 60 years old aunt because he's so scared. He cannot, he is too afraid. Too afraid. So when the people have this kind of fears, fears to be in crowd, fears to go under the bridge or in tunnels, there are other remedies also. I'm not saying only this. And they are very afraid. Give them aconite, start. Open the door. Okay? This is what the door I was talking about. They're afraid in crowds, they're afraid by themselves in bigger areas. And they will feel like ants are crawling all over them. Fears. Lots and lots of fears. Panic attacks. They feel like their life is ending. They might say it, they might not say it. They might say it or they might show it on their face. Okay? We good with aconite? Aconite, always you have to keep with yourself. Aconite. So let's do a little bit about coryza and then, okay, this is about acute anxiety. Again, I may show you uh, the people. Okay, this is classical presentation. Everybody do not give you classic symptomatology. So you'll have to look for subtle anxiety. In anxiety, in we're talking about anxiety in the children. Okay, some people, some children, when they go and they watch the movie and they get so scared, the first remedy to start with is again open the door is with what? Aconite. And then you can go back and give other remedy, but you have to start with aconite. Okay? Where is aconite? There. Okay, because you have Kilcaria cough also, you have other remedies also, but aconite has its own place. And why in anxiety? Because in if you give them anti-anxiety medicines, they have so many side effects. Okay, like if a child has experienced shock and fright, and they have watched a movie, Aconite, because it's the remedy for fear. Few doses of aconite will help them calm down. And if it doesn't, then you have to go and look for, ask a homeopath for a constitutional remedy. So it alleviates. Aconite is the first aid homeopathic remedy for acute fears that lead to remedy for acute anxiety. Another remedy is arsenicum album in acute. They are, but the arsenicum album for acutes are they're very anxious about their own welfare, with restlessness, insomnia, and worries about their future health and germs. They're very clean people. Arsenicum album. They're chilly. Okay, so and perfectionist, and they want to keep everything in order and clean. Arsenicum album. So A is for aconite. Aconite is extremely useful remedy for acute, especially due to fears, acute wind, aconite. Even when you go through acute trauma and the person is in shock, is not talking, give aconite. Open the door of the person. Or you'll see chamomilla is again. We'll talk about chamomilla next time. But aconite is extremely useful. Wicked beauty healing power. So aconite is for sudden onset, shock, fright, fear, restlessness, chill with high fever, lot of thirst, especially after exposure to chilling winds. Any question about aconite? We looked at the pictures of aconite. You see the person trembling, fears, fear to be in the crowd, fear to be by itself in the open, like to have cold water. Let's see what the picture it homeopathy shows. Uh, Anyone has any question? Then I'll just look at the Kryza little bit and we'll end the today. Let me show you. Okay, so we are looking at aconite. Aconite, there is no book which is complete without aconite. Anacardium, argentum, arsenicum, or where is aconite? Cannot be without aconite. Remedies. Oh no, she didn't put aconite. How come? Oh no. Oh wow. Argentum nitricum anacardium, there's no B. Oh wow. Okay. So this book doesn't have aconite. I have to look at, I think I have a picture copy. So this is about that. Anyone has any question? Let me look at Kuriza.
Sister Noshaba,
Yes.
I mean, everything is very haphazard in homeopathy. I have a feeling like this.
Yeah.
And any medicine can be given to anyone. I mean, I can take Econite, I can take sepia for myself, things like this.
Look, sister, that is why you're confusing two things. If a person has cancer, and can you give paracetamol or brufen to a person with cancer?
I won't give any allopathic medicine.
No, no, I'm not saying that. You have read it. You went to school, right?
Hmm.
So a person with cancer can have brufen. A person bleeding during menses, having pain in the abdomen, can have brufen. A person who went through surgery, came out of it, can have brufen. A person who broke the leg can have brufen. It's not haphazard. The thing is that you have not gone through 4 years of school in homeopathy or 3 years of school in homeopathy, you have not studied enough, so it's a lot to absorb.
Hmm, 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 hmm.
You can give brufen to 1000 different types of ailments in allopathy.
But
depending
that's
upon, but you
painful.
have to know who you are giving this to. The same way in homeopathy, you have to know who you are giving the remedies to.
Okay.
Yeah.
Hmm.
So this is the same way, but you have to do it in this way. There is we did 11:15. It's a lot about coryza again, but I just in 5 minutes I would just say the names, but I'll go over next time because it would be too much to absorb. So the coryza is coming, okay? The autumn coryza, because autumn is here, and when we are exposed to the cold winds, we get cold, fever sometime, runny nose, burning discharge from the nose, or the people are irritable, or sometimes they have yellowish greenish discharge. So depending on the situation of the presentation of the cold, you can give these remedies depending on the situation, how the person is presenting. Most commonly given remedy is aconitum. If the person has profuse or watery discharge, allium cepa is coming from onions. So remember, whenever we eat or whenever we cut onions, we are what we have watery eyes. So watery, profuse watery discharge from the eyes, especially allium cepa. Okay. Arsenicum album is a remedy when the nasal discharge is burning and the person is very, very chilly, and they will be better when they are in the warm room, and they are worse in open air, which is opposite to allium cepa. Nux vomica, again, the coryza, but these people, the nose is runny during the day and stuffed at night. Nux vomica. And pulsatilla, important thing is that the discharge is yellowish green in color. So I'll send you this, and there is more about the cough, which we can go over next time. Anyone has any question? We talked a lot.
What about eczema? Can you do eczema? I mean, it's increasing day by day. And I have seen many cases now.
No, no, eczema is a very deep situation. Eczema, we can talk about the acute eczema, but
Is it contagious?
no, no. Eczema depends on, nothing is contagious. It depends on, okay, what can go from one person to another? Bacteria or virus. Is eczema due to bacteria?
Person own condition, own immunity level.
Yeah, so how could it be contagious when it does not have any bacteria or virus or parasite involved?
But I have seen in family, in close
This
related
is
people,
sometimes there are
one is
myths.
having eczema, the other person again.